From Microbe TV, this is Infectious Disease Puscast, episode 15, recorded on November 23rd, 2022. I'm Daniel Griffin, and joining me today is Sara Dong.
Hello, everyone. I'm Sara Dong. Welcome to another Puscast. References, as always, are available in our show notes at microbe.tv, the home of our growing multimedia empire. Puscast is a review of the infectious disease literature for the last 2 weeks that we found interesting or entertaining. Now, on to the literature, shall we? I actually am starting off the viral section, which is unusual, I feel like, remember to listen to TWIV clinical updates for COVID and monkeypox related information, and I think really just other general clinical updates too. I have one quick one. In MMWR, there was a publication, Measles, Mumps, Rubella Vaccine, Priorix, recommendations of the Advisory Committee on Immunization Practices, United States 2022. So we have only had one MMR vaccine from Merck since 1978, which I learned. But in June, there was approval for a second MMR vaccine, which is called Priorix from GlaxoSmithKline. And so the advisory committee recommended this newer vaccine Priorix as an additional option and said that it is interchangeable for all indications for which you would use MMR. So just an update for those who maybe didn't catch the approval.
Okay. I don't know. Am I the only one who confuses MMR with MMWR? That probably infectious disease exclusive issue. So yes, we'll keep those TWIV clinical viral updates coming, but also as we move into the bacterial section this week in microbiology, I'm going to do a little plug actually, Sara. I'm going to be discussing an article that your friend Erin is a middle author on, and I'll try to be nice, try to be. All right, Bacterial. Be sure to listen to This Week in Microbiology with our friends there. But the article, Bacteremia with Anaerobic Bacteria in Association with Colorectal Cancer, a population-based cohort study, was published in CID. I think it may be universal that every physician who sees a case of bacteremia with strep bovis gets excited when they remember the well-described association between bacteremia with bovis group streptococci. Getting a little more frustrating that former S. bovis biotypes have been renamed Streptococcus galolyticus subspecies. I don't know if people realize, but with the renaming, people don't quite get the connection anymore. All right. In this population-based cohort study in a population of about 2 million people, including 45,774 bacteremia episodes and 231,387 blood culture negative cases performed in the region of southern Denmark and regional Zealand from 2007 to 2016. They confirmed previous findings of an increased risk of CRC, colorectal carcinoma, diagnosis after bacteremia with the bovis group streptococci. The risk within a year, 4.3%, and a hazard ratio of 8.46. But with C. strepticum, 20.8%. Also, Bacteroides ovitus, 6.7%, Bacteroides uniformis, 5.4%, Clostridium tertium, 3.6%, Fusobacterium species, including F. necrophorum, glad they included that, 3%, and gram-positive anaerobic cocci, 3.6%. So I thought this was pretty impressive that there was not just one pearl, but when you see those anaerobic bacteria, start thinking a little bit more broadly.
Yeah. I liked this next article because I feel like it was a very practical question that comes up a lot. So in OFID, factors impacting the yield of image-guided biopsy in native vertebral osteomyelitis, a 10-year retrospective study. And so previous reports have estimated the yield of image-guided biopsy to be lower than open biopsy, so somewhere around 48% versus 76%. So this was a retrospective look at a relatively big cohort, about 210 patients with suspected native vertebral osteomyelitis who had either a CT or fluoroscopic guided biopsy. So these are native, again, infections, no hardware. In this study, 110 of the 209, or 53% of patients, or sorry, I should say initial biopsies had positive micro results. And then that percentage went up to 58% having a positive micro result if you included repeat biopsies. So about 40 of the patients, give or take, had repeat biopsies. And so the takeaways were that if you were able to aspirate fluid, that can increase your yield, which I think has been sort of what I was taught as well. And then prior antibiotic use, not surprisingly, decreased the yield, which I think all of us know. About 60% of the patients in the study had some sort of antecedent antibiotic exposure. But the question that often comes up is what is that time period of the impact on the yield? And they, at least in, if you look at the paper in figure 1, have this graphical assessment and suggested that an antibiotic free period of at least 4 days would maximize yield. And they did that sort of based off the fact that an antibiotic free period of up to about 3 days showed rates of pathogen detection under 50%. So just a sort of ballpark number that maybe you can use when you're thinking about these questions that come up. But I I always like these that answer questions that we're commonly thinking about when we see patients in the hospital.
Yeah, it's always a challenge, right, to be managing these folks, and you don't have that bug. And I don't know in your practice setting, but how often are they actually really willing to do an open biopsy? It seems like
Yeah.
everything that's kind of switched over to image guided.
Yeah.
All right. The article development of a clinical prediction score, including monocyte to lymphocyte ratio to inform tuberculosis treatment among children with HIV. A multi country study was published in OFID. In this study, they assessed the performance of monocyte to lymphocyte ratio. I don't know how many people have ever thought about calculating those, but as a diagnostic biomarker, and constructed a clinical prediction score to improve specificity of TB diagnosis in children with HIV with limited access to microbiological testing. So, this study was an attempt to validate this cutoff of monocyte lymphocyte ratio of greater than or equal to 0.378. Write that down. Previously found as a TB diagnostic marker among children with HIV. So they reported in this cohort of 601 children a model using an MLR, and here they're using a greater than or equal than 0.28, aged greater than 4 years, tuberculin skin testing of greater than or equal to 5 millimeters, TB contact history, fever greater than 2 weeks, and chest radiographs suggestive of TB predicted active TB disease in CHIV, children with HIV, with a sensitivity of 94% and a specificity of 48% to identify confirmed TB.
Yeah, I feel like I realize I forgot to pick an article from this, but your selection made me think of there's a supplement in the Journal of the Pediatric ID Society, or JPIDS, that I think it's been out a couple weeks, but from October, that there's a lot of updates on caring for children with TB. So I encourage people to check that out. I definitely have some friends and colleagues who worked really hard on that supplement. Um, so my next paper was just a little bit of a discovery one, because I feel like I'm always learning about new tick-borne rickettsial pathogens. And this one was new to me. So first detection and molecular identification of Rickettsia maciliae. That may be pronouncing correctly. Someone can email in and tell me. A human pathogen in Rhipicephalus sanguinis ticks collected from southern Taiwan, was published in PLOS Neglected Tropical Diseases. So this Rickettsia maciliae has been isolated as a human pathogen in some cases in Italy and southern France and Argentina. And then the organism has been isolated from these, I'm going to say brown dog ticks, because that's much easier to say, in several areas. So France, Greece, Spain, Portugal, Switzerland, Central Africa. So this is meant to be part of the spotted fever group Rickettsia. And so this paper specifically looked at the prevalence of this specific rickettsia in ticks collected from dogs in Taiwan and showed molecular evidence of strains that may be a threat to humans. So the paper itself actually was not about a human case, but I put it in anyways because I had not heard of this specific rickettsial infection.
Okay. Good things to know for my next trip to Taipei, Taiwan. All right. The article, Short Course versus Long Course Antibiotic Therapy for Children with Non-Severe Community-Acquired Pneumonia, a Systematic Review and Meta-Analysis, published in JAMA Pediatrics. So these are the results of a systematic review and meta-analysis, right? So we're piling this really high, and it's turning into gold, we think. 11,143 children with non-severe community-acquired pneumonia. More than 95% of the participants were aged 2 to 59 months. And treatment failure occurred in 12.8% versus 12.6% of those randomized to a shorter versus a longer course of antibiotics. So the authors conclude clinicians should consider prescribing a shorter course of antibiotics for non-severe community-acquired pneumonia in children aged 2 to 59 months in accordance with antimicrobial stewardship principles. Now, question for you, Sarah. Really? Are you guys failing that much in peds? What,
Well,
12.8?
it's interesting
1
because
in
I feel like,
7?
I feel like a lot of these patients I probably don't see because I feel like I have a little biased view that I'm probably seeing like hospitalized kids with pneumonia. But yeah, it is interesting. I do think that I'm definitely in the camp that we have space to do shorter courses though, for sure.
Okay.
And then our last bacterial paper is from the Journal of Arthroplasty, which I do not think we featured before. The timing of preoperative urinary tract infection influences the risk of prosthetic joint infection following primary total hip and knee arthroplasty. Their conclusions were that patients with preoperative UTI within 1 week of a total knee or within 2 weeks of a total hip had increased risk of postoperative PJI, and that antibiotics did not appear to mitigate the risk. And so they had showed that pre-op UTI within 1 week of a total knee was associated with a higher rate with an odds ratio of 1.34 for PJI. And then pre-op UTI within 1 week of a total hip and between 1 to 2 weeks prior was associated with higher rates with an odds ratio of 1.5 or 1.12, respectively. This was a retrospective analysis of patients who were undergoing their primary arthroplasty, and then they sort of looked back to see if they had UTI. But it's a large database study that use ICD codes. There's not really any chart review, and we have no idea if some of these were asymptomatic bacteriuria versus true symptomatic UTI, which, not from the title of the paper, you're not going to know that, but I think it's very relevant to acknowledge that as a huge limitation. I'd say that this is still very much up for debate. I know that this is something that people have been, discussing and don't have a firm answer on. And I think it's also hard because UTI bugs are not, the Venn diagram of a UTI bug and a PGI bug may not overlap a ton, but, is there some other factor that is separate from the bacteria that is predisposing these patients to infections? I don't know. I don't really know what to do with this study, but I thought it was interesting and thought I would bring it up and let people decide for themselves.
Yeah, no, I actually think this is a good study to bring up because this is an issue. This whole idea, right? People love to treat bacteriuria, right? And so I think you did a good job. Like, if did they really have a UTI, or they just had? And we know those orthopods who screen their patients' urines and then want to treat them. And does that do anything helpful? Does that maybe make things worse? Actually, we saw here that the antibiotics did not help.
Yeah.
So, I think that this is an area that we need clarity on.
Yeah.
All right, fungal. We've got a lot of fungal and parasitic today. I actually was trying to limit myself because people may not want to spend an entire hour with us during the holiday. But the fungal, and we need a This Week in Fungi, by the way. But the paper, Recurrent Candidemia Trends and Risk Factors Among Persons Residing in 4 U.S. states. Why only 4? Okay, 2011 through 2018, published in OFID. So here, they looked at 5,428 people that were identified as having candidemia and 326, or 6%, with recurrent candidemia. They found about 1 in 20 people with candidemia had recurrence, and that recurrent candidemia was associated with being 19 to 44 years old, okay, versus over 65, adjusted odds ratio of 3.05, being discharged to a private residence versus medical facility, adjusted odds ratio 1.5, hospitalization in the 90 days prior to initial episode, adjusted odds ratio 1.66, receipt of total parenteral nutrition, saw that one coming, 2.08, and out of left field, hepatitis C infection with an adjusted odds ratio 1.65.
Well, I'm super excited about this next one. I'm so ready. So I have mentioned this topic before on Puscast, but cat-transmitted sporotrichosis has been increasing, particularly in Brazil. And so in medical mycology, there was a paper, Spread of Sporothrix Species Through Respiratory Droplets from Infected Cats, a Potential Route of Transmission. And so this is my episode favorite. I don't normally announce my episode favorite, but I had to include this because there is a photo and a video that shows how they collected cat sneeze particles onto a plate and then looked for sporothrix. And so when I had mentioned cat-related sporotrichosis before, it was in reference to scratches and bites, but the goal of this paper was to see if sneezes or respiratory secretions from infected cats had presence of the sporothrix. And so they had 28 respiratory samples that were collected, and 71%, or 20 of the samples, all from infected cats, grew sporothrix. So it suggested that perhaps maybe there's some utility in PPE, particularly in places where people may have more human to animal interaction. So vet care, pet shops, what that means for households with an infected cat, I'm not totally sure. I want to say that my only sadness is I don't know what any of the cat names are. And I kind of wish there was just a list of the cat participant names in the acknowledgments. So thank you for your science, cat friends. It also, sounds like they were able to provide treatment to the cats in the study, it sounds like, which I had read that often itraconazole is quite expensive and sometimes difficult for families to provide to their family cats. So I hope that all the cats did well. And if we can, we'll try to put the picture and the video in the show notes.
The cats are so cute.
Basically the video is just them irritating the cat and then someone waving the plate in front of them. So I very much enjoyed that. I hope people, as they're digesting their Thanksgiving meal and celebrating the holidays, they can check it out.
Yes, they could share those, because this is the way to make your research readable. Is not only linking it to cat pictures, but having the cats intrinsically involved. Oh my!
Well, it's like those COVID sniffing dog papers where they had those wonderful profile photos of the dogs in the supplemental.
And they had those cones, and they're going around sniffing. Yes. But I have to say, credit to those folks. They told you the names of the different dogs. So by the way, maybe actually if the authors of this paper, will have to let you know that we discussed your paper, you can let us know the names of these cute little felines.
Yeah, maybe I missed it, and I would love to know.
Okay. All right. Another comparison of mold active triazoles as primary antifungal prophylaxis in patients with newly diagnosed acute myeloid leukemia in the era of molecularly targeted therapies was published in CID. So here, the investigators evaluated the incidence and characteristics of breakthrough invasive fungal infections in 277 adult patients with newly diagnosed AML undergoing remission induction chemotherapy. There are so many acronyms in this paper. So we have BIFIs, those are breakthrough invasive fungal infections. We have RIC, which is remission induced chemotherapy with high intensity or low intensity venetoclax containing therapy, which is a anti-apoptotic protein, blocks BCL2. Patients received posaconazole, PCZ, voriconazole, VCZ, isavuconazole, ISA, for greater than 5 days as primary antiprophylaxis. PAP during RIC were included. Echinocandin use prior to, but not concomitant with the PAP-azole was allowed. Invasive fungal infection occurred after 5 days of continuous azole therapy or within 14 days of discontinuation were considered BIFIs. So breakthrough invasive fungal infections. So what did they find? They reported proven or probable BIFI in 4% of the patients. The incidence of breakthrough invasive fungal infections was 2.9% for posaconazole, 4.8% for voriconazole, and 5.7% for isavuconazole. In total, 161 patients, 58% received echinocandin prophylaxis prior to the azole initiation, but neither echinocandin exposure nor chemotherapy intensity impacted the BIFI rate. Okay.
I
I'm
haven't
not sure
worked
if I
Biffy
enjoyed that
into my
because of all the
vocab.
acronyms. What was that, Sarah? All right. The article, The Geographic Distribution of Dimorphic Mycoses in the United States for the Modern Era, was published in CID. Now, I like this because there's pictures, not as cute as the little cats. But these are the results of a retrospective analysis of greater than 45 million Medicare fee-for-service beneficiaries from 1 January 2007 through 31 December 2016. So diagnoses of histoplasmosis, coccidioidomycosis, and blastomycosis. So primary outcome was the incidence of histo, cocci, or blasto for each U.S. county, and they found that there were 79,749 histoplasmosis, 37,726 cocci, and 6,109 blastomycosis diagnoses in unique persons across 3,143 U.S. counties. So considering all U.S. states plus Washington, D.C., the district, 94% had at least one county with a significant number of cases of histo, cocci, and blastomycosis, defined as 100 cases per 100,000 person years. So we'll leave a link to this so you can enjoy this beautiful figure. But the authors suggest that persons with histoplasmosis, cocci, and blasto are diagnosed in significant numbers outside of their historical geographic distributions established more than 50 years ago. Wait, are we learning something, but are we still teaching what we knew from 50 years ago? You can answer that, Sarah, who just threw a board review. But clinicians should consider these diagnoses based on compatible clinical syndromes with less emphasis placed on patients' geographic exposure. Increased clinical suspicion leading to a subsequent increase in the diagnostic testing would likely result in fewer missed diagnoses, fewer diagnostic delays, and improved patient outcomes for folks with dimorphic mycoses.
Yeah. Yeah, the graphic for this one was really nice. You scooped this one before I could get to it. But yeah, I mean, I think it's one of many reminders that I like to say that histo is basically everywhere.
It really is.
It really
And,
is, yeah.
and everyone misses it, right? It's always delayed, and there's tons of histo and it's everywhere. You probably just went through that recent, are they still talking about the Ohio River Valley? Have they just started taking a deep breath, said, this person comes from anywhere in the United States?
Yeah, it's still in a lot of like practice question stems. There's always that very specific, I feel like when I was in Ohio, no one said Ohio River Valley for the location of anything. But yeah, and histoplasma can cause so many different clinical syndromes. So it's just so important to keep it on the list. And it's not that hard to send a urinary histoantigen.
It really isn't, actually.
Yeah.
It's
Yeah.
not that
So.
hard. All right. So moving on to a densely packed parasitic session. And we just recorded this week in parasitism. And it's a great one, by the way. So recommend people go that way. It actually is a really good one, because it's like a crossover. We discussed that malaria monoclonal antibody stuff that we talked
Nice.
about, that we scooped on the ID Puscast. So I wanted to include this article to raise awareness of a horrible disease. So the article, Knowledge, Experiences, and Practices of Women Affected by Female Genital Schistosomiasis in Rural Madagascar, a qualitative study of disease perception, health impairment, and social impact, was published in PLOS NTDs. So female genital schistosomiasis, FGS, is a neglected manifestation of urogenital schistosomiasis caused by S. hematobium. So the disease presents with symptoms such as pelvic pain, vaginal discharge, bleeding, menstrual disorders, might lead to infertility and pregnancy complications. So here the investigators performed a qualitative study with 76 women diagnosed with FGS in the Ambanja district in northwest Madagascar. The data collection was either through focus group discussion or an individual semi-structured interview. FGS was diagnosed by colposcopy. They found that a number of things, including that patients suffered from vaginal discharge, pelvic complaints. Some women expressed unbearable pain during sexual intercourse and compared their pain to an open wound being touched. FGS considerably impaired women's daily activities and their quality of life. Infertility led to resignation and despair, conflicts with the partner, and to social exclusion from the community. They also found that concealing FGS was a common behavior, which led to social isolation and delayed healthcare seeking. Really a tremendous need for education, prevention, and treatment. I have to say, this was one of my first interactions with Peter Hotez when we were redoing the update of the parasitic disease textbook, and his really feeling strongly that we needed to make sure we included an emphasis on this neglected disease. I also found the paper Dynamic Immune Profile in French Toxoplasmosis Patients, published in JID. Very interesting. There's a long arc of these types of investigations. And here, the investigators measured 23 immune mediators in 39, 40, and 29 sera of French non-infected, acutely infected, and chronically infected immunocompetent pregnant women, respectively. For 11 of the cytokines, and they list them out, the serum levels were significantly elevated during acute infection. A number of inflammatory mediators remain unchanged during acute infection, while they were significantly lower in chronically infected compared to non-infected patients. TGF beta and CCL5 levels remain significantly elevated during chronic infection, and they also observed a significant negative correlation of several cytokine concentrations with IgG levels, indicating a rapid decline of serum concentrations during the acute phase. So sort of this interesting concept that maybe that toxoplasmosis infection is not really completely dormant, but might continue to have some impact. All right. And a few miscellaneous to round it out. A prion paper. I think this is our first. The article, White-tailed deer are susceptible to the agent of classical sheep scrapie after experimental oral nasal exposure. This was published in JID. And here, the mad scientists inoculated cute little white-tailed deer by a concurrent oral intranasal exposure with the classical scrapie agent from sheep, or oral nasally with the classical scrapie agent from goats. All the deer had evidence of development of spongiform lesions after exposure from the classical scrapie agent from sheep, but none from the goats. All right. So all those that have suffered through having me as their attending will not be surprised at my excitement at the publication of the article, The Langeau Brucella Leak, the largest laboratory accident in the history of infectious diseases, ? Published in CID. Now, not as exciting as Operation Sea Spray, 1950 U.S. Navy secret biological warfare experiment, which Serratia marcensis and Bacillus globgi bacteria were sprayed over the San Francisco Bay Area in California in order to determine how vulnerable a city like San Francisco may be to a bioweapons attack. But The Lanzhou leak, not to be confused with other leaks that never happened, is the largest documented laboratory leak outbreak known in infectious disease history. In this article, we hear how patients were exposed to aerosolized brucella due to inadequate sanitation practices in the Lanzhou biopharmaceutical plant, part of the state-owned China Animal Husbandry Company, producing animal brucellosis vaccines. The factory used expired disinfectants and sanitizers, which resulted in incomplete sterilization of the waste gas from the production fermentation tanks. The waste gas contained the notoriously easy to aerosolize pathogen, which then spewed into the air, resulting in 10,528 cases of brucellosis. Is it a zoonosis when you get it from a factory? Let me introduce the new term, factorinosis.
The Operation Sea Spray just came up in our conference the other day. We presented a Serratia case.
Okay.
Well, that brings us to the end of this podcast. As always, the references for this show are available at microbe.tv, the home of our multimedia empire.
You can find the Infectious Disease Puscast at Apple Podcasts, microbe.tv/Puscast. We love to get your questions, comments, and paper suggestions, so continue to send them to puscast@microbe.tv. Consider supporting the science shows of Microbe TV. Go to microbe.tv/contribute.
I'm Sara Dong. You can find me on Twitter while it continues to stand at swindong and at Febrile Podcast or at febrilepodcast.com.
I'm Daniel Griffin, and you can find me at parasiteswithoutborders.com, on Twitter at Daniel Griffin MD, as well as on the other podcasts, This Week in Parasitism and This Week in Virology Clinical Updates. And as always, thank you for this most interesting consultation and allowing us to participate in the care of this most difficult and challenging case. We shall continue to follow along with you. Thank you, and dictation, and goodbye.
Thanks for listening, everyone. We'll be back in 2 weeks. Another Puscast is infectious.